Below is the English translation of your text, keeping the meaning and flow as close as possible while making it readable. The nerves always come out from the sides of the spine like this. The nerves in the spinal cord come out from the sides, but they don't just come out and go straight like that. They divide into two branches. One goes forward and one goes backward. The ones going backward supply the back muscles, and the ones going forward join together and form thicker nerves. They don't come out individually like that, no. They merge together and form a thick nerve. The nerve we always hear about, the sciatic nerve, what is it made of? Look, see this? 1, 2, 5 sacral nerves, and two important ones. They all come together from the back and go down like this. This is the back, this is your back, this is the sciatic nerve, and it is very long, about 1.5 meters. It starts here and goes all the way down your leg. That's why it's called the sciatic nerve. Now look at this. These nerves join together and form a bundle. They come from multiple roots, from the lower back and sacral area. Now in the front area here, what do we have? We have the urinary bladder in the front. Behind it, if it's a female, we have the uterus. Behind that is the rectum. The rectum lies like this in the body. The rectum ends at the anus, which is right below the coccyx, tailbone. Now let's talk about the colon. The colon is shaped like this. It starts from one side, goes up, then across, then down, and finally reaches the sigmoid colon, which is the last curved part before the rectum. The colon is about 6 meters long, folded inside the abdomen. These intestines are suspended inside the abdomen. The diaphragm is here, holding everything above. The heart is above it. Now, if the colon gets swollen or filled with gas, it presses on everything below and around it. It presses on the nerves, especially the roots of the sciatic nerve. That's why sciatic pain happens. It is not just a disc problem like people think. Sometimes the problem is pressure from the colon and abdominal organs. When the colon is bloated and distended, it compresses nerves, blood vessels, and even affects circulation to the legs and pelvic organs. This can cause pain in the legs, numbness, and even vascular congestion. The blood vessels that go to the lower limbs and reproductive organs pass through this area. If there is pressure here, it affects everything below. Even digestion problems like gas, constipation, and bloating can cause pressure in this region. This pressure can also affect the appendix, the small end of the intestine, and may lead to inflammation if things get worse. When digestion is blocked repeatedly, inflammation can happen in the pancreas and gallbladder as well. The pancreas and gallbladder share a drainage point, so if there is blockage, enzymes back up and cause irritation and inflammation. Now look at this structure. Everything in the abdomen is tightly packed. About 6 meters of intestines are folded inside a small space. When this space becomes crowded due to gas or constipation, everything gets compressed. This pressure can affect the spine, nerves, blood vessels, and pelvic organs. That is why people with bloating often feel back pain, leg pain, and pelvic discomfort. Sciatic nerve pain is not always just a disc problem. Sometimes it is related to abdominal pressure and digestion. The idea that sciatic nerve pain is only from a slipped disc is not always correct. If imaging shows no disc problem, the cause may still be pressure from internal organs. The body is designed to move, stand, and sit, but not to stay still all the time. Lack of movement worsens these problems. Sitting for long periods increases pressure on the pelvic area and worsens nerve compression. So the solution is not always surgery or medication. Sometimes it is lifestyle, movement, and fixing digestion. In short, the abdomen, intestines, nerves, and blood vessels are all connected. If one area is swollen or blocked, it affects the whole system.